All right, so we are doing the ankle sprain for our home exercise program, and we're going to start off with a little bit of a warm-up, just a little isometrics. So we're going to have her stand on her involved leg. So for her, it's going to be her right leg. So you can put your foot just off the ground, and if you really need some more stability, you can actually put your foot up against your right or the involved ankle. And so she's just going to stand there, and obviously when you're teaching this to your patient, you're going to be guarding them. When they're at home, they can stand up against the counter or table or something like that, so they can have some sort of guard. And so once she's done, once we progress her from that, so you can stop. We're going to have her stand isometrically and reach across her body to get some core stability. So she can just do things like that. Even I may work on her with this in the clinic, and I can just stand in front of her, and or have an aide stand in front of her, and she could pretend punch them or something like that. So we're progress next. We can do uneven surfaces. So we'll have this trusty foam pad right here. We can have her stand on that just the same way she did before, but now it's more. We're adding perturbations to her. So we're going to have her do that, and that's a little bit harder. You can see her foot shaking a little bit. And again, always guard your patients. And then we can keep progressing her again so she can go across the body, which is obviously a little bit more harder, as you can see. So we're going to do that we're going to try for 30 seconds, about 4 times. So you want to stand on your involved extremity for about 30 seconds. We're going to do 4 sets of that, preferably 2 times a day. And then we can start getting into the more strengthening exercises involving concentric and eccentric contractions. Okay, so now we're going to do some exercises with the TheraBand. So what you're going to need to do is put a hole in the end of it so they can loop it around themselves. So put it right there. And you want it on the balls of the foot so you can get the proper sort of looking for force through the foot. So you're just going to hold on to it this way. And you're going to roll up the towel and put it under the ankle so you can get full range of motion at the ankle. So we're going to do that. Is that good? Yeah, that's good. Okay, so now we're going to do plantar flexion first. So she's going to point her toes down towards the ground, and she's going to slowly lower her way back up. And she's going to do that one more time to show you. And back up. So now she can just flip it around to do dorsiflexion, and she can just tie this to like something sturdy, like a bedpost or something like that, and she's going to be our bedpost right now. So it's going to be the same way. She's going to pull her toes up towards her and slowly lower them back down. One more time. And slowly lower back down. Good. Now for ankle inversion and eversion. Thank you. She's going to wrap the TheraBand around her uninvolved leg, again, right on the balls of her feet, and so that's where the resistance is coming from. And then she's good. Yeah. And then she's going to bring her toes out towards the side, good, and then slowly lower them back. So one more time. Good. And then for inversion, she's going to cross her uninvolved leg over and do the same thing that she did on the other side. So that's where she's going to have her resistance coming from that way. Like this. There you go. And she's going to point her toes out and then slowly lower them back in. And the prescription for this is going to be 3 sets of 15 with short rests, and we're going to do this 2 times a day. So now we're doing calf raises to get the plantar flexors a little bit stronger. So she can just find a stair at home, probably the bottom stair, hang on to the railing for support, and what she's going to do is she's going to go up with both, and then slowly lower herself down. Up again, and slowly lower herself down. You're good. So we're going to do 3 sets of 10, 2 times a day. We can progress this patient by going up with both, and then only coming down with the involved leg in an eccentric fashion. So she's slowly lowering herself down just with one leg. And then we can further keep progressing her by just going up and down with the involved extremity. And what I forgot to say about the TheraBand last time was we can progress her using different strengths of TheraBand, different colors, if you will. So just always remember to be increasing your patient's program. So we'll be using these exercises as muscle strengthening and to increase range of motion so they can functionally ambulate. And the patient should stop doing these exercises if they have an increase in pain, edema, or any tingling or numbing sensation within their foot.